Welcome back to Empower Yourself. Today we will be learning about recall and mock recall. Let us see the definition. Recall is an action taken to withdraw or remove the drug from distribution or use, including corrective action, for which deficiencies are reported in quality, efficacy, or safety. So here the word itself say it as recall. That means calling back or removing the things or withdrawing the product. So it is the action that we take, that we uh, use to remove the drug from the market. In which cases it is seen is that whenever there are deficiencies in quality, efficacy, as well as the safety of a product that has been distributed into the market. So in such a case, the recall procedure is being followed. So let us see the recall classifications. There are three types of classification, that is class 1, class 2 and class 3. So when it comes to class 1 is a situation in which there is a reasonable probability that the use of or exposure to a defective product will cause serious adverse health consequences or death, and as well as banned under 26A of Drug and Cosmetic Act 1940. So here it says that whenever a drug or a product that has been taken which causes a serious adverse health consequences as well as death. So such a type of condition, and whenever the product is being recalled in such a type of cases, then it could be considered to be as class 1 type of recall. Coming to class 2. Class 2 is a situation in which the use of or exposure to a defective product may cause temporary adverse health consequences, or where the probability of serious adverse health consequences is remote. So whenever a case has happened when a product is being taken by the person which will have adverse health conditions which are temporary, but there could be a severe health issues. So whenever such a type of being withdrawn from the market, then it could be classified into class 2. Then coming to class 3. Class 3 is a situation in which the use of or exposure to a defective product is not likely to cause any adverse health consequences. So in this case, whenever a person is being exposed to the product, or whenever a defective product is taken but it is not having any adverse health consequences or health issues, then that type of recall, and whenever the product is being recalled back, then that could be classified into class 3. So let us see the procedure, how it could be categorized into. So recall can be of two types. So that is voluntary recall and statutory recall. Let us see in detail about them. Voluntary recall. So here comes the procedure and what are the cases, in which cases it could be considered to be as voluntary recall. So voluntary recall can be triggered by any incident that affects the quality, safety, and efficacy of the batch or product. Here are the questions in whatever the cases that we are calling it to be a voluntary recall. If the batch or the batches are found to be not complying with the regulatory specifications during the post-marketing stability studies. So when we are conducting the stability studies, after the product is being marketed and it is being in use, so then whenever we identify that the results or the quality of the batch is not complying with the regulatory specifications, then in such cases we can go and the company can recall the product. So whenever it is being done by ourselves or done by the company or the representative of the company, then it could be called as voluntary recall. If the batch is found to be defective during the investigation of the market complaint. So whenever we receive any complaints from the market or from the customer, so during the investigation, if you found the batch is defective, then it could be recalled back. During any failure investigation, if it is observed that the failure under investigation might have adverse quality impact on already released batch. Example, possibility of contamination, mix-up, degradation, etc. So whenever during the investigation we have found that there is a adverse quality impact, that means there could be during the manufacturing or of the product, we could see the possibility of contamination has happened, or mix up with the other product, or there could be degradation of the impurities or the product. So in such cases we identified a failure, and this has been identified during our investigations that has happened during the manufacturing or during the analysis. Then we could identify that there is impact upon the batches that have already been released into the market. So in such a type of situation, we have the procedure to recall back, and that could be called as a voluntary recall. If any unusual observation noted during visual inspection of retention samples which indicates an impact on the quality of the product after investigation. So whenever the visual inspection of retention samples is done, if there is unusual observation, that means there could be change in the quality of the there could be change in the description of the product, or any kind of visual inspection that we are doing for the retention sample. In such cases, if we observe unusual observations, then the product should be recalled back, and that will be the voluntary recall. If the post-marketing surveillance reports or pharmacovigilance reports indicate that there is a serious risk associated with the product. So whenever there was an observation that our product is being associated with a serious risk when it is being taken by the patients, then that could be recalled back, and that will be the voluntary recall. So statutory recall procedures. So statutory recall is being done when there is emergency recall which is being insisted by the regulatory agencies. Then such a type of recall is called as a statutory recall. So statutory recall can be triggered in response to the direction or mandate by the drug regulatory authorities. Either it could be central, state, or regulatory, and one or more of the situation as follows. So in any cases that is being mentioned below, in such a case, whenever a central government or the state government or the regulatory bodies mandates the product to be recalled, in such a type of recall can be considered to be the statutory recall. So to recall the drug product or batch considered to be in violation of the law, it administers such as not of standard quality. So whenever there could be a case or there could be a situation when it is not meeting the laws and it is under the violation of the law, and it is not meeting the standard quality. In such cases, when any regulatory authorities can insist to make the product to be recalled. So, and next is to recall the banned drugs. So whenever the banned drug is being recalled, so there should not be any banned drugs into the market. So if there is any case or any situation that one of the product is being in the market, so there will be a mandatory by the regulatory authorities that it has to be removed from the market. Then such a type of products have to be removed from the market. So labeling and or promotional materials that are considered to be in violation of the law. So whenever there is violation in the law, either it could be in the labeling or in the promotional material, then that type of materials have to be recalled back, and that will be mandated by the drug regulatory authorities. So levels of recall. The level of recall of a product or batch shall be determined based on recall classification and level to which distribution has taken place. So these levels can be classified based upon the distribution that has been taken place. There are three levels of recall, such as consumer or user, retail, and wholesale. So consumer or user level, which may vary with the product, including any intermediate, wholesale, or retail level. Consumer or user may include individual consumer, patients, physician, and hospitals. So this could be like whenever the product is being distributed to the level such as it has been taken directly by the patients, or it is in the consumer level, either it could be at the physician as well as in the hospital. So such a type of level of recall classification can be made depend upon the type of recall. Next is retailer level. Recall to the level immediately preceding consumer or user level. It includes retail groceries, pharmacies, hospital pharmacies, dispensing physician, institutions such as clinics and nursing homes, etc. So whenever the product that has been defective product has been reached to a level of consumer, either it is been present at the retailer grocery, that means it could be at the pharmacy, or it could be at the hospital pharmacy, or it is at the dispensing level. So whenever the product that has to be recalled has reached a level when that it could go into the market. So when we trace that it is at the retail level, so we need to recall it from the retailer level itself. Next, wholesale level. All the distribution levels between the manufacturer and the retailer. So this could be like a bridge. So the manufacturer has given it to the distributor and the distributor to the retailer. So whenever this is the bridge, this is the in between the manufacturer and the retailer. So when the product is in such a level, that could it could be taken from the wholesale level itself. So timelines for effective recall system. So as we have seen that there are three types of classes. So class 1, class 2, class 3. So let us see the timelines. So what is the maximum time that it is required to take the product from the market to the company or to the person who has been recalling it back? So when it comes to class 1, it has to be within 24 hours to a maximum of 72 hours. So within 24 to 72 hours, the product that has been distributed into the market has to be recalled back, and it has to reach the company or the person who is manufacturing the product. Coming to class 2, it has maximum of 10 days. So within the 10 days, the product has to reach the person who is recalling it back. Class 3, maximum of 30 days. So let us see in stepwise how a recall procedure is being initiated. So here comes the licensee or representative. So licensee or representative, this could be the manufacturing company that is initiating the recall procedure. So whenever there is a situation that the product has to be recalled and it is being informed to the representative of the company or the licensee, so this person will enter the recall procedure or recall initiation into the recall logbook, and this has to be entered. So whenever this has been entered in the log, then it has to be informed to the distributor or marketing company. So this could be the marketing person of the company, or whenever it has reached the distributor level, so that person has to be informed. And after giving information, those people have to, the licensee or the representative have to give the product or batch recall notice. So this notice has to be in a written format that we are initiating the recall. So the distributor or the marketing person is the person who has to identify the consumers as well as how much amount of the quantity of the product has been distributed to the persons, how much and who are the consumers and who are the customers for the particular batch. So the distributors or the marketing company has to identify the customers as well as forward the recall notice that has been issued by the licensee or the representative. So these persons, so the customers has to see the recall notification and see the urgency of the recall, and they have to initiate the recall as soon as. So the as a customers are receiving the recall notice, they have to fill the written feedback form along with the goods. So all the product recall notice has to be filled by the customers, so related to the batch that has been presented them, that and the details of all the batches, what are the details, that means how much amount of the quantity that they have received, if there is any product that has been used to manufacture the finished dosage, or so such kind of details have to be filled by the customers, and they have to return the remaining product or the product, complete product that has been with them along with the feedback notice form. So the licensee or the representative has to look forward for the return goods. So if the product along with the feedback form will be received to the warehouse of the licensee or the representative. So return goods forwarded to the warehouse of the licensee of the representative. So here the responsibility of the warehouse is that what is the, they have to be with all the information about the traceability of the batch. That means the quantity of the batch manufactured or the product manufactured, so how much amount has been distributed, how much amount of the material has been in the in the warehouse with them. So all the stock details, all the traceability have to be checked by the warehouse person, and they have to see that reconciliation of the stock. So whatever the, so they have to see if the partial quantity has been sent to one customer and the another half of the material is sent to the another customer, so they have to check all the reconciliation of the stock. So they have to get back or each and every single gram or single kg that has been sent into the market, or single package of the material that has been sent into the market. So they have, the warehouse person is responsible to look forward into all the things, and they have to be in a confident way that all the material that has been distributed has been returned back to them. So they have to be in a very conscious manner that they would get back everything, and they would be reconciling the stock that has been distributed. So after completion of all these things, we have to prepare a summary report of all the things that have been taken forward till now. That could be from the recall initiation to all the material that has been written. So during that we have to check, so we have to see that all the things have been returned back from all the customers and different kinds of levels that we have discussed previously. So after that, follow-up actions of the recall goods. So what is the investigation that we are being done for the recall product, and what is the position of the recall product, whether it could be decomposed or so all those cases and have to be recorded, and those all things have to be recorded, and it has to be maintained, and all the details have to be given in a format. Mock recall procedure. So here the name itself says that it's like a demo procedure that whether the recall procedure that we have talked about, that a particular company is in a position to get back the product in the timeless that have been mentioned. So to check all those things, mock recall procedures has to be followed by the companies, either depending on, it could be the periodical manner. So it could be either yearly once, or either it could be uh, once in 3 years. So it is defined by the particular company. So based on the periodical procedure, this mock recall has to be initiated. So let us see in detail about this mock recall. So mock recall shall be carried out for at least one batch of any product dispatched for sale where maximum distributors are involved to test the effectiveness of the arrangements of recall. So it has to be done for at least one batch of any product, or the product that has been distributed to the maximum distributors has to be recalled back. So this has to be done to know the effectiveness of the arrangements, so of the recall. So if there could be a case where recall has to be initiated, so whether the company or the particular organization is in a effective way to get back the material from the market, from the consumer level, or from the retailer level, or from the wholesaler level. So to know the effectiveness, so this has to be conducted. So during this, the following things have to be checked, and these following things are being followed. So traceability shall be performed. So during the mock recall procedure, so the material which has been distributed to the distributors, to know to how many distributors the product has been distributed. So to know the traceability, firstly we have to trace the distributors or the customers to whom the product has been distributed. So mock recall shall be performed for the longest distributor chain. So this should not be to the shortest distributor to fulfill the procedure, but this has to be the longest distribution chain in overall products that has been distributed. So this has to be performed like the previous discussion that we have gone through. That means the initiator, the licensee or the representative, have to initiate the mock recall and inform it to the marketing or the distributor that we are initiating the mock recall, and the marketing company or the distributor will identify the longest distribution chain. So the marketing person will inform the customer, and the recall notification form will be prepared, and this recall notification form shall be distributed to the customer of the longest distribution chain, and the distributor will receive the recall notification, and he will fill the details in that regarding the status of the product that has been with them, and they will send back the recall notification along with the goods to the representative. So the warehouse person will receive all the details of the batches, whether it is half the quantity of the particular batch or the full quantity of the particular batch, and did he receive the whole quantity of the batch that has been distributed to the customer. So all this detail has to be reconciled by the warehouse person, and the summary report has to be being prepared, and all these details have to be maintained by the QA head. So all the recall procedure records of such mock recalls should be maintained by QA head of the company. So whatever the procedure that has been followed starting from the initiation by using the mock recall protocol, so all those have to be maintained by the quality head. So mock recall has to be performed to check the effectiveness of the arrangements of the recall. So in this, so the recall has to be performed in such a way. So here are the references the ICH Q7 CDSCO Guidelines on Recall and Rapid Alert System for Drugs version 2017, as well as the FDA guidelines. So I think we have learned a lot about the recall procedures and the mock recall. I hope this has been useful to you, and it has given you some knowledge about the recall and how the mock recall will be performed. I hope this topic is helpful and it is very interesting to you. Thank you for watching and learning. So to know more about the topics, you can just go and give your comments in the comment section, as well as you can subscribe and do follow this channel, Empower Yourself, and you will learn more in the coming days too. So give your thoughts in the comment section so that it will be helpful to others too. Thank you so much, and thanks for watching and learning.